As you all know, women go through different stages of life, and one such age is menopause. Hi, I am Dr. Rekha Prashanth. Today I am going to talk on menopause, their symptoms and management. Menopause means when a menstrual cycle stops for more than 12 months. The average Indian women age of menopause is 45 to 46 years, though it can be 3 to 4 years earlier or 4 to 5 years later. Again, this all depends on the family history. A woman spends 1/3 of her life in menopause, so it becomes as important as any other age, as long-term health consequences needs to be addressed during this age. It is important that a woman remains fit and healthy during her menopausal age. Now let us understand what are the menopausal symptoms and how we can prevent the side effects of this menopause and give the women a healthy life. Initially, the symptoms are usually the irregular cycles over a period of 1 to 2 years in the perimenopausal age, and later on there can be hot flushes. They can have mood swings, depression, bouts of excessive sweating, sleep disturbances, loss of concentration, reduced libido, irritability, dizziness, and most important is the joint pains. Other symptoms which develops a little later in menopausal age are the vaginal atrophy, dryness. They can have skin changes, wrinkling of the skin, dyspareunia. They can have dysuria, difficulty in passing urine, frequent urinary infections, their irritability, osteoporosis, cardiovascular changes. Of course, the most important is the memory loss or the Alzheimer's disease. So when we understand that the patient is suffering with so many symptoms, we also need to understand that the physical and the mental agony what this women will be going through needs to be addressed and treated properly. So to manage these symptoms, we need to first investigate them, mainly with the history taking, a family history, with some hormonal tests like FSH and LH, and it can also be due to induced menopause, wherein the patients are being treated with some other medications which can cause temporary menopause. So the treatment of this goes both pharmacological and non-pharmacological treatment. The pharmacological treatment is mainly the hormone treatment. Non-pharmacological treatment is mainly nutrition and diet, and second is lifestyle modifications. In nutrition, it is the calcium and the vitamin D3 supplementation. Calcium with 1300 to 1400 milligrams per day, vitamin D3 of 1000 to 2000 IU per day. We also advise them to take soya up to 40 to 50 grams per day, then 1 gram per kg protein daily intake. They should reduce on their caffeine and tannin intake, and of course plenty of fluids, fruits and vegetables. The lifestyle modifications, it is mainly to stop smoking, alcohol, if they are on any long-term sedatives, avoid excessive weight gain or weight loss. They should have their regular health checks, especially eye checkup in those patients who are also having comorbidities like diabetes, hypertension, hypothyroid. Regular exercises is important. Of most important now is yoga and meditation. In spite of controversies regarding women's health, the first line of management of women with menopausal symptoms is a hormonal replacement therapy. The hormone therapy can be given in form of oral, transdermal, vaginal and subcutaneous route. Hormone therapy should be given to those symptomatic patients for a possible shortest period with minimum effective dose. Of course, hormone therapy do have benefits and risk factors both. The benefits being decrease in the vasomotor symptoms, the urogenital symptoms, and of course improves the sexuality. There is also decrease in osteoporosis and colorectal cancers. The risk factors being there is increase in chances of breast cancer, chances of increase in endometrial cancer, and also the venous thromboembolism. Of course, there are alternative methods of individual symptoms, like for vasomotor symptoms we do have other drugs like fluoxetine and others. For osteoporosis, we have calcium and vitamin D3 supplements. Urogenital symptoms, we have vaginal creams and rings, and also vaginal lubricants. Phytoestrogens are also used. Not much of evidences on how it can help in menopausal women. So to conclude, menopause is not a disease. It is a condition wherein a woman goes through difficult times during this period, and this is mainly due to the hormonal changes. Hence, everyone in the family should understand what are the menopausal changes which a woman can undergo and help her to have a comfortable life thereon. Thank you everyone for watching this video. In my next video, we will talk about hormone replacement therapy in menopausal women.